Hello, and welcome to the presentation. My name is Kira Johnson. I'm a doctoral student at Florida Tech, getting my doctorate in clinical psychology, and it is my absolute pleasure today to be talking to you about one of the most important factors in health and wellness, which is sleep. So we are going to discuss sleep in the context of health, well-being, and especially resilience. So let's get started. The reason that we're talking about sleep is that it affects so many people. 50 to 70 million Americans suffer from diagnosable sleep disorders. That's roughly 15 to 20% of the general American population. And actually, recent studies indicate that that number has increased substantially over the past 2 years to about 36%, with about half of all Americans experiencing some subclinical sleep disruption at some times. So sleep, health, and resilience are all intertwined. And it's important to talk about this because it affects so many people. So specific to military members have significantly higher rates of sleep disorders and deficiency than the general population. They are at increased risk of sleep disorders, especially insomnia, which is not sleeping enough, and sleep apnea, which is disrupted breathing during sleep. So there have been some recent and somewhat alarming studies that showed between 2005 and 2019, diagnoses of sleep apnea in service members rose by 30 times what they had been. And insomnia diagnoses rose by 45 times, which is a huge increase. Another study found that approximately 85% of service members qualified for a sleep disorder diagnosis, and this is among service branches. The second study found also that most people in that study slept an average of 5.7 hours per night, which, as we'll discuss later, is less than you need to be sleeping per night as an adult. Sleep disorders are becoming more common as work changes, as culture changes within the military, and as deployment needs change as well. So we'll be discussing sleep in general, but also be aware that this is a much bigger concern for members of the military. So let's start with why we sleep. It's important to kind of have some context for this before we go forward, because all of these things tie together. So sleep is an essential function for wellness, health, and learning. And in fact, your body will insist that you sleep. So there are three main theories on why we sleep, and none of these are exclusive, so they all kind of work together. The first is that we benefit from inactivity during dark hours. So because we are not nocturnal, we're not adapted to work and hunt and live in darkness, it is safer for us to not be out wandering around, falling over, hurting ourselves when we can't see, or being eaten by nocturnal predators. So ultimately, it's safer for us to be inactive during those times. There is another theory that describes kind of the brain growth and development that we have for adaptive purposes. So brain plasticity is just developing parts of the brain that we need during the day. So for that to happen, it needs to be done during sleep times. The third theory is really the one that we're going to spend the most time on, and that is the theory that we need sleep to regenerate and restore our bodies and minds. So all of those fit together, they kind of work together generally, and sleep really provides you with a lot of benefits. So cellular repair and renewal. Things are being repaired and restructured as you sleep. The transfer of memories and learned material from short to long-term memory occurs during sleep. This is the only time that that can happen. There is a part of your brain called the hippocampus that is specifically responsible for this. It acts as an inbox. So all of the things that you take in during the day kind of sit in this inbox until you go to sleep. At that time, all of the inbox materials are moved to longer-term storage. So if you don't sleep, or if you don't go through the entire cycle, that can be disrupted, and those memories can be impaired somewhat. Also, sleep assists in the production and regulation of hormones. We're going to talk about that a little bit later as we get into kind of the medical consequences of not sleeping very well. And then rest and repair for systems and structures occurs during this time. So sleep is really important for our well-being. During sleep, you go through a number of functions and cycles. So you can kind of think of sleep as a time when your computer would update and patch certain things. So this is the do not turn off screen. So in order to go through all of these cycles appropriately, you have to experience sleep for a certain amount of time. Sleep is controlled through a number of factors. So things that make you sleepy, things that control wake and sleep cycles are circadian rhythms primarily. So that is a normal cycle of waking and sleeping that has been adapted over time. So there are also seasonal cues, such as how many hours of light happen during the day. And then there are hormonal and chemical processes that regulate sleep as well. One of these is the accumulation of adenosine. Adenosine is accumulated as a byproduct of activity in the brain and activity in the body over the course of the day, and it causes you to feel sleepy. So interestingly, caffeine will block the effects of adenosine. So that's why caffeine will cause you to be more alert for a shorter period of time. Once you get to sleep, that adenosine is metabolized and swept away. And then when you wake up, your body releases cortisol, and cortisol brings you into a state of wakefulness. So cortisol really gets kind of a bad rap as being associated with stress. And while it is associated with stress in a long-term context, we can kind of see how that might work. So since it is associated with alertness, wakefulness, and kind of getting your body into a state of readiness to perform activity, how that might be related to long-term chronic stress. So the sleep-awake cycles are controlled through a release of hormones and the metabolism of other hormones. This is a dramatic oversimplification of that process, but these are some fun facts. So additionally, there are behavioral habits that cue sleep. We'll talk about some of those later on. But things that are associated, that your brain associates with sleep, can also cue you to be sleepy or to get, prepare yourself for sleep, and can trigger some of those internal processes. Additionally, the exertion of effort, so exercise or mental effort, can also prepare your body for sleep. So during sleep, your brain goes through a number of cycles, and you are probably familiar with a lot of these. There is the light sleep cycle, the rapid eye movement cycle, where you are dreaming and your body has been paralyzed so that you don't act out some of your dream movements. And then deep sleep, which is really, this is the important restorative updated patch area where all of those memories and learned information from the day are moved over into long-term storage. So all of these are really important. And again, your brain has to run through all of these to be able to work appropriately. So how much sleep do I really need? It's an interesting question right now because Americans sleep less per night on average of about an hour than they did in 1940. And a lot of the differences in our sleep now versus our sleep 100 years ago, it's the direct result of the Industrial Revolution and the introduction of the internet into our lives. So prior to this, we really didn't have the capacity to stay up all night, to function safely during nighttime hours. Obviously, lamplight and candlelight, you still had safety concerns and you were not able to function in the same way. We now also have 24-hour entertainment, 24-hour monitoring of things. And so that really necessitates differences in sleep. So how much sleep do you need? It is related to age. There is a lovely infographic from the National Sleep Foundation that shows you how much sleep you need relative to how old you are. Obviously, greater quantities of sleep are required for younger people. So from infants up through teenage years, you really require more sleep because of that growth and development period. For adults, and there are individual differences here, generally it is 6 to 11 hours that qualifies in that recommendation. So as you can see though on the infographic, there is kind of a not recommended greater amount of sleep as well as an insufficient number of hours of sleep. So really after that recommended range, if you get more sleep, there's some diminishing returns, right? So there are some other difficulties, other problems that are caused by sleeping longer than that. We'll talk about that a little bit later. So sleep deprivation is really defined by most of the research as sleeping for 4 hours or fewer. However, a lot of studies have revealed that there are performance deficits, whether this is performance at work or this is performance related to just functionality with 2 fewer hours a week than one might normally need. So that is definitely something to consider when you are looking at structuring your sleep schedule. So how do you know if you're getting enough sleep? This is a question that comes up quite a bit. So if you don't know how much sleep you're getting or how much sleep you need, track it. If you use a monthly calendar, you can track it by writing the number of hours that you slept and how you feel. You can also put important events in your life into that schedule so that you know how those things might have affected your sleep schedule. Then over time, you'll get kind of trends. You'll be able to see objectively what has affected your sleep positively and what might need to be modified. If you are having significant difficulty sleeping, I recommend tracking your sleep with a daily activity and sleep log for 2 weeks or better. This will give you really specific data on how your sleep is being affected and by what. So basically, this just consists of writing down what you do every day. When did you wake up? When did you exercise? When did you consume caffeine or alcohol or sugary beverages? And when did you go to bed? Then you can give your sleep a rating on a 0 to 10 scale, with 0 being awful, the worst night of sleep that you've ever gotten, and 10 being like an absolute angel. And over time, you can kind of put together how well you're sleeping and which things affect your sleep, again, positively, or which things may need to be modified. And this can give you a really great starting point from which to adapt your sleep for the best possible outcome. So what makes it difficult for us to sleep? What types of things might interfere with good sleep? We're going to talk about barriers to good sleep. And most barriers to good sleep fall into one of these 4 categories. So environmental, psychological, medical, and employment factors. And we're going to talk about poor sleep as kind of falling into 3 categories as well. So poor sleep is not just not enough sleep. Poor sleep can be insomnia, which is not enough. Sleep disruption, which is interrupted sleep. So going to sleep, waking up, going back to sleep, waking up, and so on. Waking up too early and not being able to get back to sleep. Or hypersomnia, which is sleeping too much. So sleeping over the recommended amount. So we're going to talk about each of these categories and what things might fit into them. First, we'll talk about environmental factors. So some of the things that might interfere with sleep would be screen or blue light exposure. So if you are constantly using screens, especially with in rooms that are already dim, that may contribute to sleep disruption, especially if it's right before bed, because that type of light stimulates your brain to be active. So again, other stimulating activities before bed may interfere with sleep or sleep quality, especially heavy like cardiovascular exercise. Rowdy bedfellows can especially disrupt sleep. So if you share a bed with someone who snores, kicks, punches, sleepwalks, grinds their teeth, is too hot or too cold, or is not sleeping at the time that you're sleeping, that can be very disruptive. Negotiating changes to this is also significantly more difficult than some of the other changes that I'm going to discuss with you. But children and pets may fall into this category as well, and it's important to kind of create good boundaries for everybody around sleep activities and behaviors. So children and pets, bedfellows, they can all disrupt sleep schedules, but again, we can try to negotiate some changes to improve all of that for everybody. Temperature can also disrupt sleep. So if it is too hot or too cold, although too hot is generally the complaint when people say that they can't sleep very well. Noise can be a factor in sleep disruption. So whether that noise is from neighbors living in an apartment where you can hear through the walls, sleeping at times when other people don't sleep, sleeping on like roadways or near roadways where there are trains or trucks or something else going on that makes a lot of noise. The timing of meals and beverages can affect your sleep. So if you eat a big meal right before you go to bed, your system is less efficient in digesting food right before you go to bed, and that can contribute to indigestion or things like acid reflux. Also, the consumption of beverages right before you go to bed can interfere with your sleep, not only because you may have ingested something that is a stimulant or that disrupts sleep, but also because it can cause you to have to get up and use the restroom. So that can also wake you up. And then again, behavioral habits and procrastination of sleep based around other activities can affect the quality and quantity of sleep. Some psychological factors that interfere with sleep. Anxiety can be a big one. So worrying about things, rumination or active worry. This tends to be a real concern right as one goes to sleep because your brain is no longer distracted by activities that you were doing during the day. So right before you go to sleep is not a great time to consider what you should have done today, what you're going to get, at the grocery store tomorrow, or an embarrassing memory from your childhood. And that tends to be the type of thing that your brain will attach to at that time, and that can keep you awake. So there are things to be done for rumination and worry before bedtime, but that is one of the main concerns that people come in with, is that they are worrying or ruminating right before they go to bed. Nightmares can interfere. It can make it difficult to go back to sleep. Can also make for avoidant sleep practices, so not wanting to go to sleep to avoid either rumination or having nightmares. The use of alcohol, drugs, and tobacco can greatly disrupt sleep. Alcohol is not good for sleep. Obviously, drugs and tobacco are not good for you health-wise or in a sleep context, and we'll talk a little bit more about those in a minute. Also, general stress. So stress from work, interpersonal stressors, kind of just general stress level can make it difficult to go to sleep because, again, you are stimulating your brain to be alert and aware and ready for potential threats kind of in a chronic way over time. So that really disrupts your ability to sleep well. Also, depression has a direct effect on sleep. And we'll talk a little bit about this in a second as well, that depression really has a reciprocal relationship with sleep, such that if you have depression, generally there are sleep symptoms, either sleeping too much or sleeping too little. And also if you sleep too little over time, that puts you at risk for depression. So they are really intertwined with each other. Some medical factors that can influence your sleep include things like sleep apnea. Again, we mentioned this before, and it is a big factor with military populations. Sleep apnea can necessitate the prescription by a medical professional of a continuous positive airway pressure machine, or a CPAP machine. A lot of people use those. And again, that can be either difficult to fit or uncomfortable, or can create image issues with the user. So we see some lack of compliance with those sometimes, but that is a big concern. Restless leg syndrome, chronic acid reflux or GERD, medication issues, pregnancy obviously can interfere with sleep, chronic pain, and a whole host of other medical conditions can really interrupt sleep and can cause someone to either get poor sleep, not enough sleep, or can interfere with some of those sleep cycles. The other side of the coin on these all are kind of representative of getting less than adequate sleep. But the other side of the coin kind of includes some hypersomnolent disorders or sleeping too much. So things like narcolepsy and chronic fatigue. So employment factors. This is a really interesting topic because there's a lot of recent research on this. Shift work is one of the things that interferes the most with sleep. Working irregular schedules, especially when it involves nighttime shift work. Working 16 to 24-hour schedules, as some people have to do for their job specifically, occupational stressors, and of course deployment, especially when it involves deployment outside of the time zone and into an environment where you no longer have the control that you had in kind of a personal living environment, and so on. So shift work really makes a significant enough impact that it warrants its own slide. There is a lot of research on this. It is a very big topic, and it is very disruptive. In fact, it is so disruptive to sleep that the World Health Organization has classified it as a potential carcinogen or cancer-causing agent within the last 2 years. So that really tells you how disruptive this can be. It takes time to adjust to. at least 2 weeks to adjust a sleep schedule to nighttime shift work, especially. And it is correlated with a number of physical and mental illnesses. So cannot stress this enough. For those people working shift work, it is so important to have a really good sleep schedule and to kind of find things that work in order to take some of the stress out of doing shift work, because shift work is very necessary. We need it for how we operate as a society, and as as a military installation, obviously shift work is very, very necessary. But we also got to keep, take care of ourselves and keep track of what works and what doesn't in kind of managing that shift work. So some strategies to help people who do shift work sleep better and to take care of themselves. Make sure you're sticking to a schedule. Seriously, I cannot emphasize this enough. Pick something that works and stick to it. The research indicates that sleeping immediately after work, or what's called an anchor sleep, the bulk of the sleep that you'll have for the day, is more effective than delaying sleep after a shift. The use of blackout curtains is recommended to simulate some of those circadian rhythm cues and darkness so that you can sleep and sleep more deeply. It also helps to enlist family members or support systems so that processes that you would normally take care of during those hours when other people are awake can be tended to, and your environment can be such that you can get good sleep. Also, when you are at work, ensuring that your workspace is brightly lit and that you are getting up and moving at least every 20 to 30 minutes can help with alertness. As can caffeine. There are a number of studies that show that caffeine in the first 3 hours of a shift can be helpful in maintaining alertness and reducing kind of accidents and mistakes during shifts, especially for nighttime shift work. Additionally, prophylactic naps have been researched as a method of trying to improve sleep and get some of those sleep cycles in where you can, if you are doing especially rotating shifts. So prophylactic naps are those naps that are taken between 2 and 6 p.m. for night shifts, and they usually last between 90 minutes and 2 hours. This is the only time that I'm going to recommend naps. So for everybody else, this is not the recommendation, but nighttime shift workers, prophylactic naps tend to be supported by research. So there is another type of behavior that's relatively new that we're going to talk about in the context of not getting enough sleep. And the name that's been given to this is revenge bedtime procrastination. And basically, this is the purposeful delay of sleep to increase feelings of control over your schedule or to regain a sense of leisure time when you might not have it based on your schedule during the day or during the night, depending on when you work. So this can include things like watching one more episode, reading one more chapter, playing one more game, one more round of Call of Duty, whatever it is that you do as leisure time, you can do this to delay all of those bedtime processes that need to happen for you to get adequate sleep. So this becomes problematic over time because it really is an effort to meet needs for leisure time and for enjoyment and relaxation, but it's just done at an inappropriate time that then interferes with and kind of creates a snowball effect for sleep quality. So if this is you, if you identify with the person who needs one more episode, one more chapter, some tips to stop doing that. Schedule your leisure time during the day and increase pleasurable activities, but within a reasonable time frame. Turn off autoplay on all of your streaming services. Do not elect to have Hulu indefinitely play in the background. And set a timer or an alarm for when it's time to start winding down and turning off screens, and stick to it. So other sleep disruptors that are noteworthy is daylight savings time. Daylight savings time is super interesting, and it's had a lot of research, and there's been a lot of controversy lately. So one study that is especially interesting showed that when we lose an hour for daylight savings time specifically, there is a 24% increase in motor vehicle accidents for 2 days after that change. Then when we regain that hour, or we get the extra hour, 21% decrease in motor vehicle accidents are shown for the week after that. So just with 1 hour's worth of time, adding or subtracting an hour, there is a significant, a notable change in, accidents, in health. There are similar findings with heart attacks, with suicide attempts, with stroke and other health conditions. So it really demonstrates how important just a single hour of sleep can be. One of the other big disruptors is travel and time change. So jet lag obviously can significantly disrupt sleep and impair functioning. And it's kind of the result of a disorientation of your system. So again, we are running kind of new software on old hardware, and your brain systems, as they've developed so far, really do not expect to be in Europe in 7 hours. So you really can't kind of adjust to that kind of a change as quickly as you can get to those places. So with the current state of travel, that adjustment is going to take some time and should be noted for any times when you have some sort of performance expectation that has risk associated with it. There will be some adjustment time. So the other thing that is noteworthy as far as disruption in sleep has been the recent pandemic. So since March of 2020, there has been a significant increase in the prevalence of sleep disorders. Part of this can be attributed to kind of the virtual work from home changes that some people have experienced, which really blur the boundaries between work and rest. So normally we would work at work and rest or play at home, and that is being kind of combined now. So people are ignoring their standard work hours, or they are kind of working at times when they wouldn't normally, or they're working from bed. There are people who take their computer and sit in bed and work on the computer. So all of these things are really blurring the lines that our brain and body recognize as cues, either to be awake or to be asleep. Similarly, there are schedule disruptions that have caused changes in people's lifestyles. There's been increased alcohol consumption, and that is shown across the population for the period of the pandemic. An increase in screen time, an increase in overall stress, whether that is from work, socially, family stress, financial stress. There's just been a lot more of it. And as we talked about earlier, stress can really disrupt sleep. There have also been decreased social outlets and opportunity to connect with other people. And this can have a detrimental effect on individuals. It can cause greater depressive symptoms. It can really just kind of interfere with everything. Additionally, there have been recorded episodes of post-COVID infection sleep disorders. This is becoming more common with individuals experiencing insomnia, not sleeping enough, hypersomnia, sleeping too much, having night sweats, fatigue, and a persistent cough, which will keep you awake. Another impact on people's sleep that I don't think gets talked about very often is short staffing. So the fewer people in your specific workforce, whether that be because of attrition or because people are ill or are quarantined, whatever the situation is, the more short staffing, the more that other people have to pick up the slack. And if you are picking up the slack and working more hours or extra hours, that can really take a toll physically and mentally and emotionally on people, which can disrupt sleep from the standpoint of additional exertion, but also because they aren't getting all of these other things that they need and they're having increased stress. So these are kind of the impacts that we're seeing. Again, like I said on the first slide, there has been an increase in sleep disorders and the prevalence thereof within the last 2 years. And this is part of that reason. So what are the consequences? What happens if you sleep poorly? We'll talk about that. So when you don't sleep, you accumulate sleep debt. And sleep debt is the difference between the amount of sleep that you need and the amount of sleep that you actually get. And this accumulates, the sleep deficit accumulates over time. And here's the bad news. Sleep time can't be banked. You cannot get your sleep time back by sleeping longer on the weekend, by napping, taking vacations. You just can't make up for that lost sleep. So there are effects that happen immediately that you just can't change. So that is the bad news. So what do we do going forward? We're gonna find out. This will not be as bleak as it sounds. So just be aware that things like taking naps, sleeping longer on the weekends, disrupting your schedule will actually have a more detrimental effect in the long term. So sleep debt is very powerful, and kind of as an example of this, if you function the best on 8 hours of sleep and you get 6 hours of sleep every day in a week, you've now accumulated 14 hours or almost 2 nights worth of sleep in sleep debt. So it can rack up really quickly, and especially based on environmental needs, family needs, all of that stuff, situational needs, you will not be able to get a perfect amount of sleep every night, and your body can adjust to that. But over time, you need to be aware of kind of some of the consequences of not getting enough sleep and what that does, so that we can start improving our schedules in any way that we can. So the consequences of sleep debt really fall into these 4 categories: physical health, mental health and relationships, safety, and performance. So again, we're going to talk about each of these individually. Physical health is probably the most alarming impact, as long-term sleep deficiency is directly linked to early mortality. So it is vitally important that you get enough sleep, because, and science is very clear on this, the less you sleep, the shorter your life expectancy will be. So again, vitally important to resilience, to health, to wellness, to well-being, and longevity. So when you don't sleep enough over time, long-term sleep deficit increases your risk of things like cardiovascular disease and heart attack, kidney disease, high blood pressure, diabetes and other metabolic disorders, stroke, and obesity, among others. It really is related to a lot of the effects that sleep deficit has on hormone production and regulation. So, for example, if you are sleep deprived, testosterone is interfered with. So there's a study that shows that men who get between 4 and 5 hours of sleep every night, which constitutes kind of long-term sleep deprivation, have testosterone levels similar to men 10 years older than they are. So your body cannot keep up with the production and regulation of testosterone if you have long-term sleep deficit. Additionally, hormones and chemicals like insulin, which is responsible for regulation of blood sugar, leptin and ghrelin, which are hormones that are responsible for feelings of hunger and satiety. So all of those things are kind of contributors to diabetes and obesity risk. And then there is a significant impact on immune function, both immediate and long-term immune functions. Also, sleep deficit causes degradation of portions of DNA. So errors in DNA replication and syntax put you at greater risk for cancer. So again, there are some pretty dire consequences to long-term sleep disruption. With regard to mental health and relationships, again, as I said before, sleep deficiency has kind of a reciprocal relationship with things like anxiety and depression. So it is both a symptom of and a risk factor for depression, anxiety, trauma, substance use disorders, and interpersonal problems. So problems in relationships. And really, not getting enough sleep or not getting good quality sleep can impact your overall quality of life. It's difficult to be resilient. It's difficult to enjoy what you're doing. And it's difficult to feel like you are living your best life if you're not getting enough sleep. So it's difficult to participate appropriately in social activities, to create and nurture supportive relationships, and to manage stress effectively. All of those things really suffer if you're not getting enough sleep. So with regard to performance and safety, there's also a really big impact on these things. And again, a lot of research is being done, especially with kind of large institutions, corporations, kind of in a more industrial sense, about sleep deficits and its effect on performance and safety in the workplace, and then as in functional ways. So how you function during the day or during your non-sleep hours. So sleep deficiency can affect reaction time, attention and concentration, your ability to learn and process new information, numbers of mistakes that are made during whatever task you're performing, your relationships and interpersonal skills, risk-taking behaviors, the number of risk-taking behaviors you are willing to participate in, and your appraisal of the risk of a certain behavior, and then gross and fine motor functioning. So for example, sleep deficiency is a factor in over 100,000 motor vehicle accidents per year, which result in about 1,500 deaths. So this is not something to be taken lightly. Sleep really does affect how you perform, how quickly you can react, and how likely you are to impact your own as well as the safety of others. So want to really make sure that we are doing our best to get good sleep. So now we've come past all of the bad parts. So you can take a big sigh of relief, because now we're going to talk about what can we do about it, right? So we have racked up a bunch of sleep debt. We have a lot of bad habits. What are we going to do to improve our sleep and to get back on track and start relieving ourselves of some of the sleep debt that we're accumulating? And that's where sleep hygiene comes in. Sleep hygiene just means cleaning up your sleep schedule and making sure that you are doing things that will set you up for the best possible outcome. So because I like to focus on things that you can do, the do list, the to-do list, is twice as long as the don't or do not do list. So we're going to go through these kind of step by step to give you an idea of some of the things that you can do to really change your sleep habits for the better. So the first one is the most important one that you can do. Establish a sleep schedule and stick to it. So make sure that you are not only waking up and going to sleep at the same time during the week, but also on the weekend. It's important. I know it's kind of a bummer, but it's very important if you're not sleeping well. Limit your bedroom activity to sleep and sexual activity. If you try to do more activities in your bedroom, your brain associates that with not a place where you sleep. So make sure that you are limiting bedroom activity to just those two things. Discontinue screen use at least an hour before bedtime. That will again limit the exposure to screen and blue light, which has been shown to kind of stimulate your brain into alertness. Turning down the temperature. This is a really important one. Your body has to cool itself by at least 2 to 3 degrees in order to sleep. So science says that the ideal temperature for sleep is 65 degrees Fahrenheit. Obviously, there are individual differences with this, as well as environmental factors that might prevent you from sleeping at exactly 65 degrees Fahrenheit. That's okay. But if you find that you're not sleeping very well, consider turning the thermostat down a couple of degrees. This will hypothetically help you. Additionally, similarly, take a hot shower or bath. By increasing your body temperature and then allowing it to cool back down, you can simulate that reduction in temperature and also kind of stimulate sleep. Discontinue caffeine, liquid, and sugar consumption well before bed. So there are recommendations that go up to 8 hours before bed, because caffeine can continue to have an effect at as many as 8 hours after you consume it. So make sure that whatever you are ingesting works for you. So if you find that you can't go to sleep very well, try moving that caffeine consumption back. Try limiting the amount of liquid that you have if you have the urge to get up and use the restroom in the night, and try limiting the consumption of sugary foods and beverages before bed. Consider creating a soothing ritual or routine. This is part of that behavioral cueing for sleep. So whether that is performing some sort of skincare and teeth brushing and kind of something that happens in the same order, or whether that is actively meditating or doing yoga or reading a book, whatever it is, make sure that that is consistent night to night, and that will help to stimulate your brain to prepare for sleep. Draw the curtains, dim the lights, make sure that your bedroom is dark, quiet, and cold. So all of these things will help to kind of imagine like a bear with a cave. You're going into hibernate. The conditions have to be right. So make sure that you don't have too much outside light or light from appliances or other things that you can see. So make sure that everything is dim. So similarly, turn your alarm clock away from your bed. I know this sounds counterintuitive because you want to make sure that you wake up. I promise it will still work if you turn the face away from you. However, this keeps you from doing what I call midnight math. So this is the calculation that occurs when you wake up in the middle of the night and you calculate down to the absolute second how much sleep you'll get if you go back to sleep right this very minute. So that actually wakes you up. And so that is not productive. Make sure your alarm is set and then just trust that it will go off. Use a do not disturb setting on your phone. Make sure that your phone only notifies you of the most important things that you would want to wake up for. Use a noise machine or recorded soothing sounds if you have noises that interrupt your sleep. Sometimes that can be helpful. Additionally, using a noise machine can help you if you ruminate. So if you are worrying or if your brain won't shut off, sometimes using a sound machine will help with that. Finish eating several hours before bedtime. Again, large meals before bed not only are not processed as efficiently, but also can contribute to things like indigestion and acid reflux. Meditate or use mindfulness. This is one of my favorites. There are so many great apps and kind of free content that you can use for meditation, especially bedtime meditation or mindfulness exercises to try to help relax you and get you into that state of being ready for bed. Really just, you can Google it and you will find a whole bunch of things. Try them out, see what works for you, but try incorporating that into your schedule. Involve kids, pets, and partners in your routine. So again, modeling good boundaries around sleep for children who are of an appropriate age is great. Making sure that everyone is sleeping where they're supposed to be sleeping to the extent that you're able. And if it's not working for you to have pets in the bed, the jury is out on that one. So pets, there's a lot of research on having pets or not having pets in your bed when you're asleep. Whatever works for you, but make sure you stick to it. Get adequate exercise during the day, especially if you can exercise in the morning. That way you increase those levels of cortisol for wakefulness. You get endorphins, you get this readiness for the day, and then you also kind of wear yourself out so that you are asleep or sleepy when it's appropriate to be sleepy and you're not trying to exercise right before bed. Also, discuss your medication timing with your doctor. If you are taking a new medication or if you're taking a medication that you suspect is interfering with your sleep, talk to your doctor about what time you should be taking that. So now we've come to the things not to do. So one of the most important, don't use alcohol or drugs to sleep. So alcohol, while it can cause drowsiness or induce sleep or unconsciousness, it also interferes with sleep cycling. So while you might be asleep, your sleep will not be as regenerative or as restful as it would be without alcohol. Also, depending on alcohol to go to bed is kind of its own problem. So don't use alcohol or drugs to sleep. Make sure you don't watch TV or use your phone in bed for the reasons that we discussed previously. And also, it's a really big one, don't stay in bed if you aren't sleepy. So if you've tried to go to bed, if you've tried to go to sleep, and you really find that you just are not sleepy and you're awake and it's an hour later, get up, go do something, make sure that the lights stay dim and that you stay relaxed. But staying in bed if you aren't sleepy is like sitting at the dinner table waiting to get hungry. It just doesn't really make any sense, especially when you're trying to create behavioral and environmental cues for your body to associate with sleep. So if you aren't sleepy, get out of bed, do something, come back when you are sleepy. Don't use over-the-counter sleep aids without your doctor's advice. Some of them may interfere with the medications that you're already taking. They may interfere with your sleep long-term, or they may actually be habit-forming. So make sure that you discuss those with your doctor. Try not to watch distressing content or read distressing things before bed. That especially contributes to anxiety and rumination. Again, don't exercise before bed because that stimulates your nervous system to be awake. Try not to participate in rumination and worry. So if you find yourself trying to go over an embarrassing memory from childhood or something that you need to do tomorrow, sometimes that can be stopped by writing down what it is that you're worried about and the kind of potential solution and trying to kind of leave it. So there are a lot of other treatments or solutions or things that you can try for rumination specifically, but try not to participate in that. And finally, don't nap during the day. Unless you are one of the nighttime shift workers, as we discussed previously, don't nap during the day. If you must nap during the day, science says no more than 20 minutes, because otherwise you get into sleep cycling. And it's, again, that screen comes up that says, do not turn your computer off, right? So we don't want to start a whole cycle and then interrupt that and have that disoriented feeling that comes with taking a nap of about an hour during the middle of the day. That will also disrupt kind of your timing during the day. So try not to nap. If you do nap, make sure it's a power nap. So what if you have tried all of these things to improve your sleep and nothing's really working? When should you seek treatment? And kind of what are some of the options for treatment if your sleep is seriously disrupted? So the general rule about this is that sleep disruption that lasts any longer than 3 weeks, or if it significantly interferes with your daily functioning, should be checked out. So you have some options here. You can talk to your primary care doctor, so you can discuss any medication that you might be taking that might interfere with sleep. You can discuss medical concerns that are existing or new, and you can discuss any kind of medication that you might try to sleep better. Also, you can access mental health services. You can get help there for processing stress or grief, for dealing with anxiety and depression, and kind of generally with creating a good behavioral schedule to try to improve your sleep. So there's a lot of brainstorming that can go on there, and you can kind of work through a lot of the collateral stressors that might be interfering with your sleep. And lastly, there are a lot of resources out there to help you with your sleep. So there are a lot of self-help options. As I mentioned, there are a lot of good online resources. You can do sleep tracking, as I mentioned earlier, to try to identify those things that are contributing to good sleep and that are detracting from sleep that you should be getting. Make sure that you're complying with any medication prescribed by your doctor, that you're performing good sleep hygiene habits, as I just illustrated. And if you are prescribed a CPAP machine, that you use it as directed. Research shows that only about 66% of people who are prescribed a CPAP are compliant with the use as directed by their doctor. So if you are struggling with that, make sure that you are discussing it with not only your prescribing physician, but also the people who help fit masks and things of that nature, so that you can really get a fit that works for you. So some of the really important takeaway points overall, because this is a lot of information, a lot of it seemed really bleak, and I don't want to leave you with that impression. There are a lot of things that you can do to counteract some of the effects of sleeping poorly, or to kind of get yourself back on track. So the first takeaway point is consistency. This is the most important thing for most things, honestly. Consistency is key. Find what works for you and stick to it. Really create good boundaries with your sleep time. Prioritize sleep, prioritize rest, prioritize enjoyment of things. Be creative. Do what you can with what you have. So you are in control of certain parts of your schedule, and the things that you can control, try to work within those parameters to develop a schedule that works for you and for your family. And finally, if you need help, get help. Make sure that you are seeking help if your sleep disruption lasts too long, or if it's interfering with your daily functioning. There are support systems and resources for you in mental health, medical. Look to your family and your support systems for all of those sources of support. So again, consistency, creativity, and getting help when you need it are the biggest points that you can take away from this. So again, I am so pleased to be able to bring you all of this information today and to talk about the importance of sleep. As a grad student, I can absolutely appreciate how important sleep is and how difficult it is to get a good night's sleep. So if you have, I hope you've enjoyed this information. I hope you've gotten something out of it. If I've put you to sleep, I am happy to have helped in that way too. So please take care and sleep well.